Hello, it's Dr. Rhonda Johnson, and today is Tuesday, April 13th, 2021. Today, folks, I'm talking about COVID-19 variants. Folks, these variants are here, there, and everywhere, and the CDC is closely monitoring them. They're calling these particular variants variants of concern, and public health authorities are studying these variants, which are mutations of the SARS-CoV-2 viruses, that to see whether they cause more severe disease, whether they're spread more easily between humans, whether they require different treatment approaches, change in the testing, and also changes in effectiveness of the current vaccine. So I'm basically going to be talking about 5 variants that are called variants of concern. And you know them by their common names: the UK variant, the South African variant, the Brazil variant, and there are 2 homegrown variants believed to have originated in the summer of 2020 in California. Now, the UK variant is the dominant variant now here in the United States. And did you know, folks that live in Pennsylvania, that we've had over 830 confirmed cases of the UK variant, and we also have documented cases of the South African and Brazilian variants here in the United States. Now, there was a research study that came out of Israel that is of very much concern regarding the South Africa variant and the Pfizer vaccine. This new research study out of Israel shows that the South African variant was able to infect people who had received 2 doses of the Pfizer vaccine. In this study, the presence of the South African variant among people who had received 2 doses of the Pfizer vaccine was 8 times higher in the vaccinated people than those who were not vaccinated. So it suggests that this South African variant has mutated so it can break through the protection of the Pfizer vaccine, according to these Israeli researchers. So we'll have to be watching that and see if other people are able to confirm these findings. Now I'm going to talk about the Brazil variant. What has public health authorities concerned about the Brazil variant is what's, of course, happening in Brazil. And it seems like in Brazil, this variant is causing a lot of reinfection in people who were previously infected with COVID and thought to have immunity. So this is very concerning. The Brazil variant is spreading rapidly in the continent of South America. And here in the States, Massachusetts and Florida are the states that are seeing the highest number of cases of the Brazil variant currently. Now, those homegrown variants, the California variants, believed to have come out of Southern California last summer at the height of the California COVID pandemic, and they are believed to be capable of causing increased person-to-person transmission of COVID-19. So, folks, all of this means that this is not the greatest news. And this pandemic has taken a new course, and the public health authorities are testing these variants against the current vaccines, stepping up genomic testing to determine the genetic sequences of these viruses, and the race to get the vaccines into arms has accelerated. Here in Pennsylvania, the state is rolling out, effective today, because we have a growing case count, a growing hospitalization rate. The state of Pennsylvania has opened up vaccine eligibility for everyone 16 and older. They're calling this universal adult eligibility now. So forget phase 1A, phase 1B, phase 1C. Forget all that now. We no longer have to worry about it. Now, if you're 16 and up, you can get the vaccine. And please, folks, take whatever vaccine you can get. So what's my take-home message? We must all remember that people can still get infected even after being vaccinated and potentially transmit the infection to others. We also got to remember that these variants need to be taken seriously. Folks, we still got to keep wearing our mask. We still must be mindful of ventilation in the spaces that we are visiting, and we have to try to keep indoor gatherings with people outside our bubble to a minimum. Folks, we have to be careful. Keep working on lowering your risk factors. Keep trying to strengthen your immune system by eating healthy, getting enough sleep, exercising, taking vitamin D and a multivitamin supplement, and trying to lose weight if you're overweight or obese. We have to be mindful that although the vaccine rollout is well underway, the cases are climbing. Just look at Michigan, folks. The hospitals are still filling up, and nothing, sadly, has changed much in terms of how this virus kills its victims. We also know that the number of people with long-haul COVID, or the long-term manifestations of COVID, keep climbing, and there's no cure for COVID at this time. So be careful. Please get whatever vaccine you can get. It's open up time now. Let's all get vaccinated. And please feel free to share this video with your family, friends, and colleagues who are still on the fence about getting vaccinated. As always, my views are my own and are not to substitute for advice from your doctor. My sole purpose is to help people stay alive and have a blessed